Happy Monday, guys. Welcome to STM LLC. So, February is Heart Health Awareness Month. And with that being the case, I wanted to talk about heart health awareness as it pertains to massage therapy. So, again, you're probably going to see me look down. I have some notes that I'm looking from here, making sure that I get you guys the most accurate information possible. So, like I said, February, Heart Health Awareness Month. I wanted to aim at like raising the awareness about like heart disease, risk factors, and some preventative measures, mostly massage. Let's go ahead and face it. Um, some of the preventative measures being like getting regular exercise, managing your weight, quitting smoking, and of course, managing your stress. When people talk about heart health and disease, they're talking about, or they'll say cardiovascular health. That is a wide umbrella of a variety of different conditions that pertain to things that may be affecting your heart, your circulation, and your blood pressure. So, with cardiovascular disease, aka heart disease, it's like an umbrella of conditions. It includes like diseases of the blood vessels, structural problems like heart structure problems, as well as blood clots. So, getting very particular about what you're talking about can help you get the best help that you may need as it pertains to your heart and cardiovascular health. Some of the most common types, some of them are like coronary artery disease, where it's like a damage to major blood vessels within your cardiovascular system, and again, mostly at the heart. Arrhythmia, which is an improper beating, whether it's too fast, too slow, or just a regular of your heartbeat in and of itself. Peripheral artery disease. It's a circulatory condition that is it narrows the blood vessels where it reduces the flow of blood to like from the maximum and maximal that it could be. And as a result of that, high blood pressure is something that is comes as a result. So a high blood pressure is a condition like it forces the blood against the like artery walls a little bit too much. It becomes a little bit too high, and that becomes dangerous because it puts extra pressure on your veins, it puts extra pressure on your arteries, it puts pressure on your whole system to work that much harder. If you're not getting blood to where it could be cutting off blood from your brain, which causes strokes. It could be cutting off blood and supplies to your limbs. Then that means like you are not getting the proper amount of blood flow to your hands, to your feet, and that causes several other conditions. With blood with high blood pressure, also known as hypertension. If you hear people say hypertension, that's the same as saying, you have high blood pressure. So I want to make sure that you also have definitions in here because some people will hear certain things and they're like, I didn't realize that meant this. Let's get ourselves educated on the things that we can. So hypertension is defined as high blood pressure. And I remember at the time it used to be 140 over 90. Oh, at the time it was 120 over 80. Today it's 140 over 90. And I'm not sure if that's because our diets in the country have changed so much that we had to accommodate for what looks like healthy at this given point. But that is something that kind of made me sit up and go, oh, like they're raising the blood. Why is that being raised? Why can't it be lowered? And what does that say about the foods that we're taking into our bodies? Just a little something for you guys to think about. Oftentimes there are no symptoms. That's why it's called the silent killer, because you could have high blood pressure. You could be walking down the street thinking everything is fine, and then you can pass out because your blood pressure is too high, but you're not aware of it. Being a silent killer is, again, very dangerous because you could go in and not even be aware. I remember in this past June of 2024, I went in and I had a procedure for fibroids, and I wasn't fully sedated. I wasn't fully knocked out. But my blood pressure when I was done, and it wouldn't come down very readily, started with a 2. Now, it's saying even at its higher standard, 140 is what it's supposed to be. Mine started with a 2. But I felt nothing. I felt fine. I went there. I went to go have my procedure. I thought I was going to go rest for a couple hours, maybe like a day or two, and then everything was going to be normal. That was not the case. So if you're not sure about what your numbers are, going into your medical professional and making sure that you're getting checked and making sure that your numbers are where they should be is a great way to start to understand like what things are going on and how you can control them if they're not currently controlled. Just a little PSA from me to you. It can be caused by things like genetics, unhealthy diet, lack of physical activity, and I think the one that gets people most of all, stress. Now, stress is a psychological. It all starts up here. It's a psychological stress is the body and brain's way to respond to life's pressures and expectations. So when those things are said, the things that you're not aware of course, you have people that um, that kind of get on your nerves and cause you to go "Urgh," and kind of hold some things in all the time. People may have bills that are too high. We are all, as a country, looking at the price of eggs. I mean, that's enough to stress anybody out. Um, we are looking at people who are passing away and losing loved ones, and again, that's another kind of psychological stress. Another way of the brain saying, "Hey, this is not okay right now, but we're going to be all right." Um, the natural reaction to everyday pressures, unexpected things, stress can be emotional or psychological. And emotional stress, again, starting here, psychological stress, starting here, that causes a process called vasoconstriction. Anything that you think of veins, vascular system, constriction. Like, think about boa constrictors. Those snakes wrap around you till they cut off like supplies that you need to live and have everything flow properly. So when it says stress causes vasoconstriction, it takes all of the blood supply in your veins and it restricts it just a little bit. It takes it and makes it not flow as much. It takes it and constricts it so that your body does not function the way that it should. It's not getting the supply, it's not getting the oxygen it needs to function properly, causing a chain of reactions in those blood vessels. So when you get stressed, the body's like, danger, danger, and it'll send out chemicals. And in those chemicals, you have cortisol, you have epinephrine, and norepinephrine. And that's produced in response to a perceived threat. The body is like, wait, hold up, let's send out our soldiers, let's send out our threat soldiers so that we can understand what's going on here and we respond the way that we need to. So with cortisol, right? Cortisol increases blood sugar levels and enhances the brain's use of glucose to manage stressful situations. We all know that when you have too much sugar well, most people know, that when you have too much sugar in your blood, that can be one of those things that produces diabetes. And especially like if it's too much sugar within the brain, also certain other conditions, dementia, Alzheimer's, things like that, because of very stressful situations. So we don't want to be put under stress a great deal. Not what we want to do. Epinephrine it causes the chemical again. It causes rapid heartbeat, increased blood pressure, and just a heightened alertness. If you see those people who are always walking around and their eyes are this big and they're on edge and they're just they are in a panic situation. So that again is not good. And norepinephrine is like, okay, it's the same as epinephrine. It causes that alert, but it's like, should I stay here and fight or should I run away and get to safety? And you're having all of those reactions happening at the same time, affecting your blood pressure, affecting the pressure of the blood on the walls of your veins, making you be in a threatening situation because it has no real signs. There's nothing that says, hey, my veins they full to capacity and they being squoze on, and we don't really know what that looks like and we don't know what it's going on for, but it's happening. Just because you're not aware that it's happening doesn't mean that it's not happening. It means you're not aware. So if you're unaware, you can't do anything about it, making that situation very dangerous. Stress, and it affects all the systems of the body, including the musculoskeletal system, the muscles, the skeleton, how we move, how we can get out of dangers and harm's way, the musculoskeletal system. So within that system, muscles tense up and it contributes to the extra pressure on artery walls. So the way that the body is configured, right? Say you have, again, I don't know if you guys saw the last video, but veins and stuff, they run through your muscles. And muscles are attached to the bone. So everything is like Spider-Man. You have that tendon holding on to this bone and this tendon holding on to this bone. And in the middle, you have all of your muscles. Within the middle of those muscles have to know what messages they're getting. So you have nerves that are shooting through there. And in those nerves, you have arteries, you have veins that are pumping blood so that you're getting the proper blood supply so that it has everything else. When you get stressed, the brain sends a signal to the body to tense up your muscles, and it sends the brain signals to the body to put extra pressure on all of those things. So you're putting extra pressure on your arteries, you're putting extra pressure on the nerves. So you might have some tension that's going to cause pain, but then you're having your arteries being squeezed, which is causing the extra blood pressure. Stress, again, just not a healthy thing. And over time, stress and tension will cause pressure and high blood pressure, most of all. The musculoskeletal effects of stress leading to high blood pressure are some of the reasons, along with medications, that a massage is a good treatment to help with blood pressure. So we know massage therapists work with muscles, tendons, ligaments of the body, manually releasing the stress and tension from the body, taking the time to say, hey, body, woo, 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 it's okay. We can do this. It's going to be all right. And making sure that everything is okay in there, you know? So during a massage, the body will release chemicals like endorphins. And endorphins are the body's natural painkiller. So getting a massage where things, you know, maybe in getting to that point where it doesn't hurt anymore, depending on the type of massage you need, it might be a little uncomfortable. But after the massage is done, you're like, you know what? It doesn't hurt anymore. Now, during the process, I might not have liked you a whole lot, but after this process, I feel good. Because it released the endorphins that make you have those natural painkillers. And then you have serotonin and dopamine. And those are neurotransmitters. And it sends positive, it's the neurotransmitters that are associated with positive moods. So your body sends you all these good chemicals and says, you know what, you can have a good mood. You can, you have that good mood, and a good mood for you, and a good mood for you. And your body starts acting like Oprah and just sending out good mood, dopamine, and serotonin all over the place just because you got a massage. Those are just some of the things, and a really quick way of explaining how massage can help with stress levels by helping to send the opposite chemicals of stress. So you have the stress chemicals, you have the feel-good chemicals, and the massage will help send those feel-good chemicals to you, which is why getting one, in addition to taking your medication, eating more healthy, and being more positive, can help you combat the factors of high blood pressure. I know that I went over things and it may have been like some quick things, but there is an ebook that is being produced, and the name of that ebook is Relax and Renew: The Power of Massage for Blood Pressure Relief. And in there's, again, 10 chapters, 10 very short chapters, that has you understanding blood pressure a little bit better, intro to massage therapy, how it can help you lower your blood pressure, self-massage techniques, creating a holistic approach to manage your blood pressure. These are all things that can help you. When these ebooks are available, I will definitely get on here and let you guys know that they are available. But in between, if you can do something like take a deep breath in through your nose and let it out through your mouth, that just helped me feel a little bit better right there. But taking the time to even do that, like if you're at your desk at work and you can't get up and say, I can't get up and go do exercise right now, but I can take these deep breaths, do whatever you can do to make sure that you are combating the effects of potential dangerous things to your body like high blood pressure. This is CC Rex. Again, if you have not taken the chance to subscribe, I ask that you do. I appreciate you being here right now. I have goals and I want to help as many people as possible with the information that I'm putting out there. So if you haven't already, hit that subscribe button. The next goal milestone for me is 50 subscribers so I can do this live and get more interactive with the ways in which I share information. I appreciate the 4 people who have subscribed already. Don't let me leave you guys out because you were very important. You were very, very vital in me not feeling stressed today. So I appreciate you because I got up and it was like 4 subscribers. I think I may have a 5th one that may have come along. I appreciate you too. Absolutely understand. I appreciate all the ways that you guys make me see that this is something that's well worth it and something beneficial for you in the process. I appreciate all of you. Have a happy Monday. And again, if you haven't taken the time to do one of the things listed to help your blood pressure, I challenge you, go out and do that today. CC Rex, STM LLC. See you next time. Thanks a lot, guys.